goal is to create that personal relationship with our patients. I know most of my patients by first name. I know their kids, grandkids, their dog's name over the years, depends on how long we're together. And that's important to me. I've found that to be very important to patients. And when we develop that relationship, then we can start with the health and health span. It's important to stay healthy as long as you live, even if you don't live. I can't promise you to live 100 years old. But if you're healthy up until it's your time, that's my goal. That's what I want. This is a good stepping stone and a foundation for that, and this Mike can help you understand some new things about how healthcare is moving in a different direction, I guess you could say, in a good direction.
What if there's a way to have continuous access to a supply of millions of the most valuable cells in your body that keep you healthy, help you repair, help treat chronic inflammation. I'm sure many of you Marshall medical patients have heard about, hey, we got to control your inflammation, right? Inflammation is disease, and potentially slow down your aging. And I'm saying potentially because that's an FDA thing. I can't say for sure, but the research is out. I just came back from another meeting, and this one in Vegas, and I wish I could share the presentations I saw because it's mind-boggling. But obviously, I think most of you would like to know more. So, next slide. Now, imagine that you could use those cells also on first and second degree blood relatives. So if you were to harvest your cells, or you would have your adult child, harvest their cells, those cells can be used not only for yourself, but for your mom, for your grandparents, for your children, and for your siblings, and for your grandchildren. Okay, so theoretically, right?
Just start at the basics. So stem cells. So when we're created, there's one cell. It's a stem cell. It divides and divides and divides and becomes a human. Stem cells are always present in our body, but as we age, they kind of slow down, just as every other cell ages. Stem cells is how we repair. So you cut your arm, it heals up. That's due to our stem cells. They either do it themselves or they secrete little molecules that bring other cells in to help heal. So that's basically what a stem cell is. We'll get deeper into like the different types later, but just as an overview, that's how we heal ourselves. That's how we stay youthful. That's why when a kid cuts their arm, it heals quickly. Sometimes no scarring. I cut my arm, not going to heal as fast. Probably a scar, right? We'll talk about the other stem cells, but that's the basics of what we're here. We've been able to harness that over the years to help promote longevity. Very, very crazy good results with various diseases that we've been throwing medicines at for years that we can actually do from your own body.
Physicians are busy. Concierge medicine's a little different. They're busy too, but they're dedicating their time to doing things like this instead of fighting with insurance companies for your pre-authorizations, okay? This eventually will be its own category, just like pain medicine is now a category. Functional medicine is becoming a category. Stem cell banking is done, it's FDA compliant, okay? It's done in an FDA compliant and lab that's tested. They got a perfect score, the one that we're using. The compliant instruments are used in the harvesting of the cells. They're accredited. We need to say, hey, we can't say that we can cure things, right? And we really can't say that, we can't make too many promises, but we can show you the data on what's being out there, and you and your clinician can make a decision whether the treatment might be something that you want to do.
The uses we've been using those for years with what's called PRP, platelet-rich plasma, or stem cells that are pulled out of your bone marrow. There's usages for joints, there's one of the Kardashians coined this, what's it called, the vampire facial, where you microneedle your own PRP or stem cells into your face, which regrows collagen, makes you look youthful and younger. The cool thing about what we're talking about tonight, adipose-derived stem cells, and stem cell banking and harvesting from your body they're yours. They belong to you, so that means you get to do what you want with them, and it's not as regulated. Outside of practicing sound medicine, doing what we know best and what we keep learning. So if you have a knee that needs to be replaced, instead of having surgery, having a PRP injection or a stem cell injection can actually regrow your cartilage. Maybe not all the way, maybe not 100%, but if you're 65 years old and you get 5 more years out of your own knee before replacing it, that just makes sense. And it's a 10-minute procedure versus going under anesthesia, having surgery. That's just some of the uses. I harvested someone recently who is wanting to use theirs for macular degeneration. Evidence has been shown, stem cells you inject in the eye, it takes away macular degeneration. Is everyone going to get that result? Probably not. But there's the hope, and the better and better that we get at this, and more and more things we're allowed to do, then why not use that, your own body, instead of going through surgery or traditional routes? I would like. There's 2 books you can listen to or read, whatever. Heavily researched, reversing Alzheimer's, different things like that. There's one called Lifespan by a guy named David Sinclair. He's been known to be the world's leading anti-aging guy. And then the End of Alzheimer's by a guy named Del Bredesen, who actually has Lexington connections. They don't even touch on stem cells. And when you add stem cells to some of the therapies that they have been approved to do and are doing, it's going to be amazing. Just imagine if anybody in here who knows anyone has Alzheimer's, who lived through it. Imagine being able to take that away from them and you, and the burden on them and you.
Or just slow it down, right?
Or
improve the quality of life. Get it to where they can still go to the bathroom on their own. I mean, the quality of life for the caregiver and the patient. So not everybody's gonna, remember everybody's name, but it is pretty crazy. This is some stuff they're already doing with regenerative medicine. So not necessarily is stem cell banking for everybody in here. If you just have an issue with your shoulder and that's it, and you're 35 or whatever, and you're not thinking about the future with the stem cells, I'd say you should, but PRP might be a great solution. So don't think that there's only one solution. We've got like 5 different solutions. If you want to go to the next slide, and then we'll get through that and get on to what you were talking about. This is something else, shockwave therapy. So shockwave augments this, but this is like an external PRP. PRP, basically we take your blood, we spin it, we isolate, and we get something called the buffy coat, which has platelets in it. Those platelets have growth factors, but they also are signaling devices. So when we put it in your shoulder that maybe has stopped healing, it basically attracts your stem cells. It says, hey, I'm broken here. You forgot about me. And so those are signaling devices. Well, they're going to bring in what? They're going to bring in stem cells and growth factors from your body. But at 59, I know I have about 40% of the healing potential I had when I was 20. So I only got so many stem cells to go there. And so augmenting with stem cells for me makes absolute sense. This is a very simple way to do it. This also breaks up scar tissue. It's great for shoulders because most people, when they hurt their shoulders, they end up getting scar tissue, and that causes a lot of problems. Low cost, very, very easy to do. You come in once, twice a week for about 6 weeks, and it's amazing the results you have. Next one. Exosomes. Has anybody heard of exosomes? Yeah, hands. I'm just kind of getting an idea how many exosomes come from stem cells, and they're becoming a bigger and bigger thing because they actually are what communicates with your cells to have those cells do certain action. So we use those in different things. They use them a lot in the face for facial, because for skin. So it's like You do PRP with or without this, but it's a game changer. It helps with the inflammation immediately, but it helps start to signal your body to repair the damage, the wrinkles, the crepey skin. So here's the part on the stem cells. All right, so we're just going to go through those things.
Well, I kind of touched on this a little bit about the different types of stem cells. And over the years, stem cells has gotten a bad name, just like hormone therapy, even though it's all good and safe. Depends on, where we get them from, how we use them. I'm sure there's people in the room who've heard of people going to Panama or Mexico and getting a load of stem cells and stuff, which is actually great and pretty amazing with what they've done with the research. Actually, I met the guy, his name's Neil Reardon, and he's the leading stem cell researcher. He owns a big clinic in Panama, but he's doing studies here, FDA approved, that is regenerating people's nerves to where if you're a paraplegic, you do stem cell therapy and you walk again. The types of stem cells that I'm talking about that we're using, and I'll tell you more advantages to what we're doing in a minute. Not only is it yours, but the adipose-derived stem cells have been shown to be the best. When you go to Panama, I'm not saying anything bad about that. I would do it if I had 50 grand. I don't. They're good, but they have to give you so much just because they die off quicker when they're infused. The adipose-derived stem cells, which we harvest, 90% survive at 3 months out, or
There's studies showing over 3 months they're still alive in your body.
so they're still working. And so if you go and let's put the knee aside or the shoulder or whatnot, if you infuse the stem cells into your bloodstream, they go throughout your body and they find the cells that are not doing what they're supposed to do, or they're what's called senescent or quiescent. They're slowing down, and it wakes those cells back up to start healing you again. Or if they're too far gone, they kill the cells off, which is called autophagy. That's something that's normal. It's happening right now in our bodies, especially when you fast. So intermittent fasting, long-term fasting, that's why that is so good for you, because it goes and kills off the bad cells, lowers your risk of cancer, liver disease, whatever, just all around the board. But back to the adipose-derived. So when we take those, they're yours. They're banked. When John says banked, that means they go to a lab. They're repeated, stored in a vial for you, for a lab fee, of course. They're stored indefinitely. The cool thing about what we're doing is you can go generation to generation. So if I had mine harvested, so my kids can use them, my grandparents, my parents, technically my grandkids eventually. So what I love for people is, most of my patients are a little older, not that young, so I'm like, all right, find your youngest, healthiest kid with enough fat that we can harvest and store. It can benefit the parents, their kids, any siblings that are wholly related, and they're there forever.
Adipose cells are in your fat where there's not great blood supply, and they're protected by these collagen, they call them like time capsules. They're dormant and they just sit in there, but they're not getting exposed to most of the things that make things age. So one of the simplest things I heard was it's about your stem cells 1/10 of your age, your adipose-derived stem cells. So would I take a 7-year-old, I'm not 70, a 5.9-year-old cell, and would that be a great cell to have? Absolutely. But the most important part is it survives. Adipose-derived stem cells survive in your body, and during that, the most conservative estimate for every cell you put into your body, that's your own already, it's creating 17 million exosomes per hour per cell. So if you infuse 10 million cells, it's trillions of exosomes and growth factors. It's just in there. I call them like little exosome factories, little growth factors things. And so it's in there, and that's why there's no studies really, not many studies that show that perinatal cells, which means like umbilical cord, Barton's, actually regenerate tissue. But what they are really good at is squashing inflammation fast. So they squash inflammation, but they're dead within hours of putting it into the body. They're not made to be, they were made to create a baby in the uterus, not to recreate tissue. You know, I got a picture, beautiful picture of my granddaughter with all that fat. Tell me how many umbilical cord cells are in her helping her grow. Tell me when she falls down or she prevents disease, how many umbilical cords are helping her do that? Zero. She has none. It's all the adipose-derived stem cells and some of the other stem cells, like, you know, you have all kinds of different types of stem cells, but there's none for that. So what I've learned is that disease is not carried by stem cells. So we have patients with disease that like you know, I have Parkinson's, but we have Parkinson's patients that get harvested and they're using those stem cells to help them. So that's not an issue. They are protected from most toxins, not to say that there's not some of that going on, but it's very little. The other thing that we do when we take those, we got really smart PhDs in the stem cell lab, and that's all they do. And they'll sort through and they'll find, when you give a harvest, we'll take 20 cc's, which is like 2 tablespoons of fat from you. We send it to the lab, and then they differentiate. So we now have technology, so we're compliant. We don't need to use that collagenase, so that's why it's legal now. That's one of the reasons. Also, there was a court case that regulatory-wise why it's legal, but we have a special way of using ultrasound to separate the cells. But what they do is they pick out the strongest cells and they replicate. So your cell that is coming back to you, when they'll build like 20, 30 vials of 10 million each, so you have hundreds of thousands of stem cells at your disposal. They'll be stronger cells than what you donated. Okay, because I call it, they don't have the Twinkie factor, right? They haven't been exposed to Twinkies, right? It hasn't been exposed to the gin and tonic. So these cells that are replicate to healthier cells. If you have an old car and it's low on oil because it's old and it burns oil, what do?
Add oil.
You add oil, right? Because now you can keep driving that car, but what's going to happen? Eventually it's going to break and it's going to be expensive. You're going to blow a head gasket, transmission's going to go, oh, whatever, right? So that's my theory. That's why I do stem cells, you know. And I've got some, you know, use them on my mom, my son, and I get emotional. Sorry, it's amazing. Anyways,
About the markers on
Yeah.
your mom with one.
incredible.
We're watching.
Went homocysteine 19.1, 5 vials of my stem cells 11.1. CRP down 40%. From you're going to die to you need to do better, right? Now, 85-year-old German mom, she's not changing her habits. So what's happened 4 months later? Creeping up, 14.1 homocysteine, CRP's creeping up. So guess what we do? Every 3 months, she gets an infusion of my stem cells, just an IV push. And guess what? We're keeping that controlled because I'm not going to get her to exercise. I tried. I'm not going to get her to stop eating the processed foods. I tried. I mean, I've tried. It's not happening. So I'm like, but this is a way to control that inflammation. But for me, you know, I take a look at my health and I'm like, I got cancer on both sides, blood cancer, right? So what can I do to prevent that? Well, I'm not going to say that this can prevent cancer, but I know it can do, I know that when do people get sick with cancer? A lot of times. They're stressed, right? And they're worn out. Their immune system's shot, right? So if I keep my immune system strong, I'm thinking I've got a better chance of not getting it. So adipose-derived stem cells are excellent at fixing your endothelial lining, the linings of my walls of my vessels. So if I keep my vessels strong and not weak and compromised, those little boogers won't get in there, right? Because that's what happens. You have a weak endothelial linings, that plaque just digs in, and then all of a sudden you've got a problem. You got a potential heart attack. So I'm all about how I'm spending my money now so I don't have to spend it later. I'm spending my money to prevent disease, and that's anybody that's with Marshall Lifestyle. That's it, right? It's a whole different, if you're not with it yet, it's a whole different way of thinking things. It's not our old medical system like, okay, we're going to do this, and oh wait, you have this problem, and now we're going to address it, and we're going to put a Band-Aid on it. We're going to give you a drug that's got like 5 other things that you're going to take 5 other drugs for. I'm going to stay healthy. That's my thing. I'm going to be the strongest version of me possible. Keep my immune system strong. Just reduce my risks for all those things. I have 2 torn rotator cuffs. I've got 2 slap tears. Both shoulders are shot. Never had surgery, all through regenerative medicine. Some with PRP, some with that. Next is my hair. I'm going to fatten up my hair. It's great for hair. Adipose-derived stem cells, great for hair and skin. I'll start doing the skin stuff. So sexual dysfunction or sexual optimization, hey, we're going to create more blood vessels, better blood flow. All those things can be done with the adipose-derived stem cells. So there's unlimited things you can use it for, but I'm just like, I'm going to just keep my bank of stem cells up. I'm going to keep my tank full, right? So I'm less likely to break.
While we're talking about the endothelial lining, so I just wanted to bring up a couple of things. So in our blood vessels, there's the endothelium, which is it's like the brick and mortar to keep stuff out. So what we've found is inflammation is really the key to all disease, cancer, heart attacks, Alzheimer's. When we lower inflammation, keep inflammation at bay, you're probably not going to have an issue for several years, as long as we do that. Now, is there a magic drug? Is it stem cells? Is there a magic pill? No. There's a lot of lifestyle modifications to that. So when you guys read or listen to those 2 books I mentioned earlier, you're going to hear this being repeated all the time. It's inflammation. I've got to meet one of the leading interventional cardiologists in the U.S. His personal cholesterol is around 300. Most cardiologists would shit their pants without them being on a statin. But he watches his inflammatory markers, he made lifestyle changes, so he has 0 inflammation, and he's completely fine with his cholesterol being 300. So that would tell you how important inflammation is. Piggyback that onto stem cells, it eradicates as much inflammation as possible. So when you're talking about running it IV and going systemically, it just makes common sense to me. That's one thing. Yeah. Back to your mom. Yeah. If you don't change some lifestyle modifications, then you just spend more money on stem cells, I guess. But when you learn of these little holes in the ceiling that you can plug over time, and then you add the new stuff to it, like we're learning, that's why I'm doing this. I love it. I think it's amazing.
One of the other reasons I do it is all right, so I walk out in this parking lot, some jackass hits me. I'm in the trauma center, right? First person I'm calling is Chris and saying, get my stem cells over here, because guess what? I want to heal like a 20-year-old. I don't want to heal like a 59-year-old. And we know that when you use stem cells and they're in your body, especially if they can inject them right in there, but we don't scar. A lot of these, how are these pro athletes? They have an ACL tear. You're out 6 months. They're playing in 8 weeks. That's all stem cells, buddy. They're also younger and they got good nutrition. But no, it is stem cells. They're using stem cells to help speed up that whole process. So back to the inflammation. Inflammation causes disease. How many people have heard that dementia is caused by inflammation in the brain, right? It's a big part of it. So I get mannitol, which opens my blood-brain barrier. That's what I did last time. And when I get my infusion, every other time I get mannitol because 10% more is going to get to my brain. So when do people find out that they have an issue with inflammation in the brain? It's when they're already forgetting shit and they're a mess, or they're lucky enough to get in a car accident and they do a scan of their brain and they're like, your brain's full of inflammation. It's like the luckiest accident you ever got into, so they can start treating it. I'm not waiting to find out. I'm not going to pay for a scan. I'm just going to pay for 2 vials, put the mannitol in there and open my blood-brain barrier and get more. I'm just all about crushing inflammation. If there's nothing that you take away from this, stem cells crush inflammation. Healing. I go to the gym, somebody that's 20, we do the same exercise. We do it incorrectly, bad form. He gets a little tear. Oh man, that hurt. I do the same thing. I'm like, oh man, that hurt. 2 weeks later, he's healed, right? Mine's partially torn. Do the same thing, same bad form. I got another little tear, right? His is getting healed because he's got plenty of stem cells. Next thing you know, pop, done. I've got a complete tear. The 20-year-old doesn't because he's got plenty of stem cells circulating in there fixed. You only have so many. Melissa had the choice to get harvested, but her daughter stepped up and said, I'll harvest, because it just makes sense. It's a younger cell, right? So probably got some advantages there. But clinically, we treat patients. I'm 59, I got harvested. I didn't make my kid do it, right? So I'm very confident that, if you don't have someone underneath you that wants to do it. I also like doing someone underneath you because they can do their siblings, they can do their kids and their grandkids. So because I don't have any great grandparents, to use, and I don't have any grandparents to use it on. I just have my mom's the only one left. So going down a generation, you get to treat more patients. Yeah.
So the process, so how do we do this, right? So we get your fat. So basically, it's just a very simple in-office procedure. No downtime, maybe a little soreness on your flanks. So we usually go on your flanks or love handles. That's been shown, like this area has been shown to be the best adipose tissue. And it's a very easy procedure. It takes about 30 minutes in the office. Suck your fat out so you get a little bit less fat on your love handles. They go to the lab. They grow them. No, I do both sides. I equal it out. No, trust me. It doesn't take a lot. I've done people with plenty of meat, and I've done guys that are pretty built. As long as there's a little bit of love handle fat, which there almost always is, we don't need that much of it. So we take it out. The in-office procedure, like I said, it's just 2 little incisions, suck out your fat, put the wounds back together. That's it. I was sore for maybe a day. That's about it. No other issues. And some people they're not even sore. Like, man, I can't believe that. But that's like going to the dentist is way worse. And I agree. So the fat goes to the lab. That's where they isolate the stem cells, regrow them. It's a little 6 to 8 weeks to get enough cells, and then you decide when and how you want to use them, and then we help coordinate that, whether it be in your knee or your big toe or IV or on John's hair. So however you want to use them. It's a very easy procedure. I like to thank you for that. I like to step by step talk patients through it to take some of the scariness out of it, or just make it extremely transparent exactly what we're doing, what you can and can't do with them, and what you expect from it.
They build you over 100,000, which is 10 vials. They always do like 30. Okay, you can prepay because they're not going to grow 50 for everybody. Like I have some people that are probably overkill, but they'll do 10 vials every 6 weeks. That's a lot. First of all, I do 2 vials every 2 to 3 months, right? So there's plenty there, but they grow them. There's no extra charge for us to grow more cells. So as soon as you get down to below 10 vials, they're already growing you more cells. So there's no charge for that. So I can't say that it's an unlimited supply, because eventually after multiplying, they might need to, I mean, this is, hundreds of vials. I think
it's a one-time fee then?
But it's a one-time fee, yep. And then if for some reason, let's say, like we have MMA fighters, we do, right? They're doing them during training and after every match, and I mean, they're just burning through these things like crazy. Those people, they might have to get reharvested at some point. And then our company pays for, I think it's like a $1,500 charge that you have to absorb. But basically, they're going to regrow. But I have one person, I've been doing it 3 years, and I've got one person who's just burning through them at an extraordinary rate. But that's out of 1,000 patients that we have nationally.
What is a stroke?
Absolutely, that's what's my emergency. I'm always going to have 10 vials in that. I mean, you talking about just cutting your rehab to a quarter. I mean, it is phenomenal. Stroke is probably one of the most amazing treatments that we do. Parkinson's is not easy, but yes, they're treating Parkinson's and having great success with that. Of course, dementia.
Symptoms before and after, or do you do blood work?
Both. So that's the nice thing. So I'm always a big advocate of doing the labs and getting the markers and saying, hey, before you even get your first stem cell infusion, let's take a look at where you're at. Because sometimes certain things will happen before the labs change, but a lot of times things will change. You won't feel the difference until your labs change. And so you can actually, like with my mom, I don't know that immediately she felt like, oh gosh, I feel like I don't have any inflammation. And by the way, it's my mom, so she's always going to have something going on. So I have to get something objective, because subjective, she's going to want to talk to me about something that's broken, right? Something that's not right. But so yeah, labs are important, and there's plenty of markers that we can now identify for different autoimmune. We know which ones to look for. And I think this kind of sums up my theory. It's saying, I'm not banking because I'm broken. I mean, I got a couple things, but I'm banking because I don't want to be broken, right? And it's a whole different way of looking at your health. I'm like, and I'm gambling on it. I'm like, I'm spending money now, not a ton, but I'm like, hey, if I can prevent these things, and theoretically and based on studies, we can, and I wish I could share everything. I mean, I could talk to you for days about it, but when I just went to that conference, there's a great one on anti-aging. They used the most recent age prediction test, and I think it was like 2 months after an infusion, it's like they were 4 or 5 years younger based on that. Now, those things aren't perfect, but if you get enough of those tests and it keeps going down, then there's something to it, right? So, office visit, consult, do you want to do it? It is a walk in the park. This is not surgery. This is 2 little incisions. They stick no big lipo vacuum. It's a little syringe. We pull back this plunger. It's a walk in the park. The processing, again, it takes about 6 to 8 weeks. Sometimes with younger donors, they have more dense population of stem cells. So my record is 5 weeks. They were able to get some. Also, the size of the sample, if we get 30 cc's, then we have more that will duplicate. But the big thing is we do it right. We do it naturally, which is why we're compliant. We put it in a perfect environment. We don't use bioreactors, which are pieces of equipment that force the cells to multiply faster. And that's where they're doing down in like Puerto Rico and South America. They use bioreactors to make as many of those cells as they can. And along with that, after doing it several times, then you get into the risk of mutations. And so there's no risk of mutations here. That's a good way to think about it. That's what I want to do when I'm 80, right? I don't want to be the grandparent that can't take my kid to the water park because I can't take those steps. So that's kind of my motivator.
What's wrong with gray?
What's that?
What's wrong with gray?
No, I'll keep gray. I dye mine gray to look like you, Chris.
Well, I think we'll wrap it up, but we'll be around for as long as you want. We can take questions to field to everybody, or you can come chat with me personally or John. I really appreciate you coming out, and hopefully give you some knowledge, not only on just stem cells and what we're doing, but just overall health and inflammation, and what we're doing at our clinics is a lifestyle change. All the newest stuff that we can find to help you guys develop the most personal relationship that we can have. That way, when you come in and we're talking as friends, and I'm not barking orders at you. I would never do that. I make suggestions. I spent a long time with my education. I can continue it every day, and I want to pass that along. I'm not here to tell you what to do. I'll give you some good information when you ask about it, and maybe I can help.
Great.